When it comes to childbirth, there is an overwhelming amount of decisions to make. One of the most important decisions, where to give birth. In this video, I sit down with my midwife to talk about the difference between a home birth and other places of birth, such as a hospital or a birth center birth. Hi, it's Kristen from Marie Naturally, a channel all about natural living and lifestyle, including topics like motherhood, beauty, health, and more. Recently, I sat down with my midwife, Shannon, and we talked about some of the most common questions that get asked about home birth and midwifery care. And I thought that I'd put all these questions and topics into a series because we had a lot to talk about. I hope that you find it helpful, and feel free to take a look at all the other videos in the series. All right, let's get into the video talking about the difference between home birth, hospital birth, and birth center birth. What would you say the main differences, I guess, between home birth versus hospitalized birth?
You're taking responsibility for all your own choices. Midwives don't have a staff. We may have student, we may have birth assist, we may have another midwife coming, but we don't have a full hospital, and that puts a lot of pressure on us to make sure that things are going well. It puts a lot of pressure on us if something doesn't. And I feel like the parents, one of the phrases I use when I'm talking about, risks and things is always that, if time is of the essence, we may not have the time to get to a facility in the way that we would like to. There's someone who trains us for neonatal resuscitation who always says 90% of all babies, it's actually a quote from AAP, 90% of all babies will be just fine, 10% will need some help, 1% will need more than some help. They will need intense, resuscitation, and you have to keep that in your mind all the time. Well, as parents, it's a different choice. It's like you're choosing, that 90% of everything being just fine, 10% maybe you'll need a little help, and that you'll have time to do that. And it's hard to say that a 99% chance of everything being just fine is the only thought in everyone's minds, but we pretty much all feel pretty invincible. And I think that the difference between home birth and hospital birth is that when you go into a hospital setting, you're expecting everything to be perfect, everything to be fine, and for them to handle it. And with a hospital birth, when they tell you to do something, you don't think in terms of choice. You don't think in terms of, I don't want to do that, how do I not do that? Everyone in the room is primed to put you down their chute of how things happen. We do this, we do that, we're going to put an IV in you, we're going to give you Pitocin, we're going to, we need you to push this way, we need you to roll over, we need you to do this, or, you need to roll over now. And it's not a choice situation. And with home birth, I feel like, when someone says, well, what position do I need to be in to push? I'm like, well, what position feels like when you're pushing feels most productive? Do you feel the baby move down? And if that's not working for you, after a couple of pushes, let's change positions, because we need to find what's helping to do that. And in a hospital setting, that's really not how that works. I think it's changing a lot in some hospitals where there's nurses who are more capable of doing that, doulas who are more capable of helping to put back in that choice scenario, and also helping people to navigate that system. But in a home birth situation, it's a continual process of renegotiating everything. It's how do I feel about this? When do I feel about this? And, do I feel comfortable in this position? And, it can actually be a real challenge for home birth. For sometimes when you have a mom who's suddenly having a baby and she looks at you and she's like, I'm not sure how I feel about this anymore. And you're like, okay, all right, then let's talk about that. What is it that you feel like needs to change here? And usually it happens during transition. So this is the point where you're kind of questioning everything about having a baby. But at the same time, it's that's an important clause to remember in all of this, is that you are in choice, no matter if it's home, no matter if it's hospital, no matter wherever you're giving birth, no matter what time it is. If you're choosing to change the plan changes, and it should change. And that's what I think the biggest difference between hospital birth and home birth is. If somebody looks at me and says, no, this is not working for me, then I'm like, okay, so here's some other options, here's some other things we can do. What is it that you feel like you need to change in this moment? And I do feel like that's honored in a way that you don't necessarily get to honor it in the hospital setting. Also, the best part of home birth is that you don't have to get up and go somewhere else to have your baby.
Yes.
It's like at birth center, I loved my midwife, but being bounced at 4 hours to, or 2 hours, I'm not sure how long it was with him, but being bounced at a couple of hours, it felt disorienting, and it felt like having to get up and go home, and it felt weird to suddenly be back in my own living room managing my own postpartum, but not in a way where I had actually been in bed that whole time resting. I was wide awake, and there was no restfulness. And I feel like that's one of the best parts of this, is that at a home birth, you are able to go straight to, like, I want to take a shower. I'm going to go take a shower. I want to go to the bathroom. I'm going to eat. I'm going to drink. I have my own food. I'm not having to order it from somewhere and hope it gets here. Mm-hmm. It's not cold. Nobody's managed it. It's what I want to eat.
Yeah.
So I feel like there is a lot of personal touches to birth that we have inside of our own cave.
Yeah. You feel so comfortable with what you're familiar with. Like you told me that most of the births you attend are fast births, which, I mean, I wonder if part of that is because you're so comfortable being where you are that, like, things just happen more naturally, more fast, versus, like, I just remember being at the birth center when I traveled from home to the birth center with my first, like, it slowed me down and, like, just felt so weird and all that. What do you think?
Well, and there's two things. There's gauging the fear. It's, I need to go somewhere, so when do I need to go there?
Yeah.
So as you're thinking about that, it builds up adrenaline, your contractions get stronger, they get weirder and stuff, and then you start to get in the car, and then of course you're in the car, so everything's sitting on your cervix, you're feeling more contractions, you're getting scared that this is going to happen in the car. Mm-hmm. So by the time you get there, then all of a sudden everything sort of slows down and sort of stops, and you're like, what's that? Well, it's just your body renegotiating. It's letting go of all the cortisol. It's letting go of all of those fear chemicals. It's letting your brain relax again, and then find labor, and then labor builds back up. Mm-hmm. And the same is true for hospital birth, is that, it's like, how do I gauge what time I need to get there? And do I need to get there in enough time to have the baby there? But I don't want to get there too early, because I don't want a whole bunch of things to happen to me because I haven't had the baby yet. And it's a weird little gauge model. And I feel like when you're in your own house, knowing when to call the midwife, and some people miss. They're like, I think I need to call the well, okay, this baby's coming really fast, and the midwife's kind of like trying to get there in time. But usually when babies are born quickly, it's usually fine, and that's not an issue. But it's like, it is something where, as a midwife, it's a little nerve-wracking to make sure I get there on time. But like, even with your situation, your birth came pretty quickly after I got here, but you were listening to your body, you knew what your body was doing, you were doing all of the things. So really, that's just part and parcel of how this is supposed to unfold. And I do feel like there is something about being in your own bathroom, your own bedroom, your own space, where you get to be in a place where you're like, this is okay. And I feel like it's harder to do that inside of a one room where you can't move or change.
Okay, so what do you think? Is home birth something that you're looking into, or something that you already have experience for yourself? I'm super curious, so let me know in the comments below. And also hit the notification bell and subscribe to my channel so that you know when I'm uploading new videos. All right, thanks friend. See you later.